Good afternoon, everyone. Thanks for joining us today, joining the National African American Tobacco Prevention Network as we host promising practices for tobacco prevention and control in African American communities. This will be a webinar and live panel discussion. The National African American Tobacco Prevention Network, or NAATPN, we are a national organization dedicated to facilitating the development and implementation of comprehensive and community competent tobacco control programs to benefit communities and people of African descent. NAATPN is one of 6 CDC-funded national networks that engages national and statewide partners by providing technical assistance in tobacco control and prevention activities. The purpose of this meeting today, we are going to discuss and review some outcomes impacting tobacco control and prevention in African American communities. We're going to talk about some promising practices and community competent initiatives that are currently taking place. We're going to look at opportunities for action that could impact African American communities, and we're going to begin a dialogue on how we prioritize these opportunities for action. Where are we going in terms of emerging products?
We're going to now focus our attention on what we call generally as emerging tobacco products, but in actuality, in reality, some of the products I'm going to talk about have really been with us for many years, and I'm sure many of us remember chewing tobacco. I mean, I know my great aunts and uncles, my grandparents, they all chewed. However, the products that are now on the scene are very diverse. And even traditional smokeless tobacco or chewing tobacco is produced and packaged very differently now. So the landscape has dramatically changed over the last few years, and these products are not your typical cigarettes. These products are designed, marketed, and they're distributed differently. And they've been introduced by the tobacco companies in many cases as replacement type products. Given the fact that cigarette smoking has declined in the United States, they've taken note of that, and they have something right behind it. And also, we also now have federal regulation of cigarettes and tobacco products. So I'm going to cover an array of products, and there's probably some that are emerging that we necessarily haven't seen, but trust me, this is like the tip of an iceberg type of situation. So we're going to cover little cigars and cigarillos. There are a difference. Snus, snuff, dissolvables, hookah, new cigarettes, and then the e-cigarettes. And now we also have e-cigars and e-hookahs. Just can't have enough to go around, can we? Okay, so why in particular are these products an important issue for our communities? I think there's many reasons for concern. In the past decade, cigarette consumption levels, as I said earlier, have declined, but we are seeing increases in sales of these particular products, and particularly little cigars and cigarillos. And we particularly are seeing increases observed in young adults, 18 to 25-year-old black males. There's also perception issues. So for example, with regard to little cigars and cigarillos, that these products are safer than cigarettes. And in fact, cigars contain many of the same cancer-causing chemicals as cigarettes. They're just as toxic. And with tobacco, smokeless tobacco products, some also incorrectly speculate that these products can help someone to quit smoking. Let's not forget that these products contain nicotine, the vast majority of them do. So a person can get addicted to them just like one can get addicted and have gotten addicted to cigarettes. There's also an issue with respect to what we call, and was referred to earlier as poly-use. I was most recently visiting my mother-in-law down country in part of Georgia, country Georgia, I'll just say that. And I saw a young man walking across the street, and he was listening to his iPod, and which is typically what we see. And in one hand, he had an e-cigarette, and in the other hand, he had a cigarette. Talk about multitasking, but for all the wrong reasons. I was just blown away. I said, now, first of all, how in the heck is he doing that? You know, along with the fact that he's listening and not paying attention to the traffic, but I digress when I say all this. You know, the bottom line is that economics play a very big role here. These products are generally much less in cost because the taxes are less on them. And so if money is tight, where are you going to go if you're a smoker? You're going to be attracted to these products. Currently, along complicating with all this, there's no national prevalence data for little cigar or cigarillo products. So most surveys that are out there now ask about cigar use in general, where indeed you have to actually break it down. You have to be very specific in terms of brand, because that's how folks refer to it in terms of their usage. We are truly in a learning curve with respect to learning more about these products and also who's impacted by these products and the subgroups even within our communities. To further illustrate my point about cigar use in young tobaccos, this is a chart from a survey, which is the National Survey on Drug Use or Health, the NSDUH it's called. It's conducted by the U.S. Substance Abuse and Mental Health Services Administration, which is nicknamed SAMHSA. This is a large survey they do amongst teenagers and young adults. Has a large sample size, I believe it's 60,000 plus. And what this particular slide reports on is prevalence rates in the African American community and other ethnic communities from 2002 to 2007. And if you note here on the slide at the very top, it's that sort of fuchsia colored line. Black male cigar use is high when compared to whites, when it's compared to both white and black women, and when it's compared to Hispanics. One slide I don't have here to share with you is another one that shows that younger black males are more likely to smoke the top cigar brands, including little cigars and cigarillos, than any other group.